Hey everyone, this is Danae. I don't know how to add sound to PowerPoint, so I'm just going to do a video. So bear with me. I'm sorry if the quality is not the best. I'm going to be discussing health issues of the frail elderly for week 6 of population health. First, a definition of frail elderly. I got this from Walston 2019 up-to-date article. There are many different tools that can be used to assess whether or not an elder is considered frail. The tool that I thought seemed the most straightforward was the physical frailty tool, and it defines frailty as meeting at least 3 of these 5: weight loss, exhaustion, weakness, slow walking speed, decreased physical activity. If there are 2 or less, then they're considered pre-frail, according to Walston. Of course, when you think of the elderly in their homes or just the elderly at baseline, there are some common concerns. These can be even more serious with the frail elderly. So I kind of took from Walston what the article was saying and devised this SAVED acronym, I guess. And it's important to think about safety. Frail adults are more likely to die from falls. This is just because all the compounded issues that can occur when somebody falls, especially the elderly with issues with bone mass, things like that cause, maybe fractures, things that could make it more difficult to heal. Adverse health outcomes, they have early mortality and an increased functional decline. Vulnerability, obviously these people are not able to fend for themselves in a lot of ways that they used to be able to, which creates some issues of vulnerability. A frail adult living in an environment that's not really safe is a major problem, could contribute to falls and other concerns. And then there's disability and death, and this is just, again, through researching and up-to-date that the frail elderly are more prone to disability from chronic conditions and death. I kind of get disease prevention and health promotion confused at times, but I like to think of it as 2 sides to a coin. So disease prevention, how to keep people from becoming ill, eliminate factors that contribute to chronic disease and frailty. So a factor that does contribute to frailty is smoking, and so one could quit smoking. Believe it or not, staying out of the hospital for a frail adult, being in the hospital can be even more dangerous than being in their home. And if you just think about it, we know there's a lot of sick people in the hospital, and if a frail elder, gets a flu or gets the flu or gets, something that they picked up at the hospital, can be life or death for them, as well as falls, which are more dangerous for the elderly across the board in the hospital than at home. And then kind of just maybe doesn't come second nature to us, but just backing off on aggressive tests and screens. A lot of these contribute to more risk for this population than benefit. Like I said, other side of the coin, health promotion, encourage quality of life for the frail elderly, distinguish what is most important. They may have very different goals in mind than we do. Modify risk factors that are modifiable. So quit smoking, environment changes to improve safety, get them plugged in with different resources that can help make their lives better. Engage in healthy activity, cognitive and physical exercise. According to Walston, there's good data that frailty is reduced in group exercise versus individual exercise for frail adults. Some practice model change examples, and this kind of is where we come into the population health stuff that we've been reading. The big focus is integrated care, and so there are a few models that are discussed in the Walston article again, including comprehensive geriatric assessment, so a multidisciplinary approach to optimizing life at home. PACE program, which is a Medicare program, which I did not realize until today. I have had patients in PACE programs, but I thought, I don't know what I thought, if it was a company or what, but this basically provides a day service of clinical staff, social workers, transporters, just helping people be successful outside of the nursing home and in their homes. Then there's hospital care and ACE programs, and I think what this is referring to is kind of the swing bed idea, which offers like a more comfortable kind of place to rehab, maybe, than going home. Frail adults are more likely to not do well at home after acute illness and acute hospitalization. So practice impact for me, I think there's, the shift in the models of care. Palliative care kind of has a bad rap, I think, in some ways. I think, well, maybe that's changing more, but palliative care really is family-centered and helps patients and families clarify end-of-life goals, looking at their values and preferences, and can be really just a blessing to patients and families across the board, and really should be considered if a patient is frail and probably looking at end of life sooner than later and have some needs like comfort, just different things that can be, met with a palliative care provider or team. And then the integrated care, like we talked about in the previous slide, and then community utilization. I think there's a lot of resources in communities with senior centers and different things that can help bring access to homes and just make life easier for those who are frail. The whole mindset of less is more as far as testing and intervening and prevention stuff. Sometimes those preventative things actually cause more issues for these frail adults than the benefit. So, and then just helping to make life easier. Maybe your patient has a struggle with just even the mechanics of eating. How can that, be adjusted and things like that. Other things to think about, I thought about occupational therapy. I read about occupational therapy helping frail adults in their homes with ADLs and just kind of setting up their environment for safety. Focus on nutrition. Consider mechanisms of eating, adding protein where they're able, to kind of get their weight up to help them be healthier and not lose weight, which is a very common thing with frail adults. Medication review all the time. Certain drugs may no longer be needed and should just be removed. And then stay away from ineffective intervention. So because of like because frailty is associated with like endocrinology and just different deficits there, a lot of times people have thought, well, we can do anti-inflammatory or hormone therapy. It's really not beneficial, and there's no data to support that. That is basically it. I hope you guys are having a great night, and see you soon.